Chronic myeloid leukemia is an uncommon leukemia of a group of diseases called myeloproliferative disorders. It is manifested by slowly uncontrolled proliferation of mature and maturing granulocyte in blood and bone marrow. Granulocyte is the most common white blood cell. As we all know, the body produces millions of blood cells each day, which is formed within the bone marrow that contains immature stem cells. Stem cells differentiate into myeloid or lymphoid cells. A myeloid can either form monocyte or granulocyte. Other myeloid stem cells develop into red blood cells or platelets. Since in chronic myeloid leukemia, myeloid cell lineage is primarily affected, this will lead to abnormally functioning neutrophils, platelets, red blood cells, basophils, eosinophils, or mast cells, causing signs and symptoms of breathlessness, fatigue, bruising, infection, bleeding, bone pain, fever, weight loss, splenomegaly. Because CML is slow growing, a great majority of patients might stay asymptomatic, and in fact, a routine blood test might just catch the culprit. CML is one of the few cancers known to be caused by a single specific acquired gene mutation called the Philadelphia chromosome, which means a positive family history will not be a risk factor for chronic myeloid leukemia. This genetic mutation leads to formation of a new gene called BCR-ABL, which in turn stimulates the blood cells to produce too much of it protein called tyrosine kinase. Tyrosine kinase promotes cancer. Radiation exposure is the main causative agent for CML. It primarily occurs in old age, but any age can be affected. It's more common in males. CML is divided into three phases: chronic, accelerated, and blast. Diagnosis is by detailed history, physical examination, blood and peripheral smear, bone marrow analysis. Splenomegaly is the most dominant physical finding in patients with CML. Treatment entails chemotherapy, especially tyrosine kinase inhibitors, interferon alpha, myelosuppressive agents, protein translational inhibitor, and allogenic stem cell transplant. Take loads of care and keep praying for all the sick patients in the world.